Dweller. Happening tomorrow, the governor is set to take action on a more than $300 million Medicaid package. That package was passed by both chambers of the General Assembly last night. But as WECT's Delaney Tarpley learned today, some of the provisions in this Medicaid package have a significant amount of opposition. Delaney, the NAACP, American Civil Liberties Union, and American Cancer Society all sent a letter to lawmakers highlighting what they see as issues with this package.
Yeah, that's right, Fran. There are a lot of concerns over coverage for immigrants, new work requirements, and a new maximum allowable copay of $35 per healthcare visit. But despite that, the bill passed in both the House and Senate almost unanimously. And now it's up to Governor Stein.
On Governor Stein's desk right now, a more than $300 million funding package for Medicaid. With fears funding for Medicaid would run out by May, it passed almost unanimously in both the House and Senate Tuesday.
Motion to adopt the Conference Report House Bill 696, having passed its third reading.
But several provisions have civil rights and patient advocacy groups sounding the alarm.
This letter is from everyone from the American Cancer Society to the NAACP to the ACLU.
That's Representative Pricey Harrison. She listed off some of the provisions that those groups took issue with. The American Cancer Society specifically called some of the provisions, quote, a worst case scenario for cancer patients.
The burden really would be very large. This would very much make it extremely difficult for cancer patients to, just receive timely Medicaid insurance.
American Cancer Society's Government Relations Director, John Broome, said the provisions he's most worried about are a new maximum allowable copay of $35 for each healthcare visit, plus work requirements for 3 consecutive months to get coverage.
One who has Medicaid insurance would essentially have to provide 3 months of either work, education, or service, which when you're going through cancer treatment, that's unbelievably burdensome, at times physically impossible.
The new funding bill would also impact immigrants. It would effectively cut off 27,000 pregnant women and their children from Medicaid coverage due to their immigration status.
This is a very difficult and somewhat cruel provision.
Department of Health and Human Services employees would also be required to report undocumented immigrants seeking Medicaid coverage to ICE.
Lord, y'all been seeing what's going on around the country about individuals who've been snatched up by ICE illegally, inappropriately, and mistakenly. We don't want to fall into that trap.
House Republicans say those concerns are not falling on deaf ears, and changes could be in the future.
This is a bill that we needed to get out. Not a perfect bill. I've never seen one since I've been here. We've got work to continue to do.
Governor Stein will take action on the bill tomorrow morning at 11. Delaney Tarpley, WECT News.